You got a great rank. You must be getting radiology, dermat, or anything.
Yeah.
Why medicine then?
So I just had one choice in mind, and that was medicine.
And why you chose neurology as your favorite branch?
I felt that neurology was more closely the actual medicine, DM neurology or cardiology. You've got that liberty to decide the way you want to work.
So how was your neuro first year as a resident?
He's probably the most overworked person in that department.
So post your DM, what was your first step?
After DM, I wanted to start practicing.
So what are the normal fellowships that are available after neurology?
After neurology, I've got fellowships in epilepsy.
So where do you see this branch 10 years down the line?
In the coming years, neurology is going to boom.
So what is a life like in a corporate hospital for a neurologist? How much does a neurologist earn? Immediately after doing DM?
So for a neurologist to begin with,
we are building India's largest community of Medicos, and thank you so much, each one of you, for making it a possibility. Today we have invited again a very special guest. He is of course an MBBS and MD General Medicine and a DM in Neurology. Neurology, I was getting so many requests that we should invite a neurologist to our show. And finally we have found a great one. He has done his deep research in this field, and he is also a national level educator with more than 20 years of experience in this field. He knows this field in and out, knows how to set up a private practice, knows how to excel in this field, and is the best guide for every neurology aspirant in this country. So let's put our hands together and let's welcome Dr. Rahul Rajeev. So welcome Dr. Rahul sir to the Nachiket Bhatia Show.
thank you so much for having me here.
Sir, we have all heard a lot about you, the way you have grown in your life, the way you have become a national level educator, and the best part, you are a neurologist. All three big things.
Thank you so
So
much.
before we get into that, the field of medicine, the field of neurology, I would like to know everything about you. How did you enter into the field of medicine, MBBS, medicine, then choosing DM? What was the journey like?
So first of all, thank you so much for having me here. And talking about my journey, I'm basically from Kerala. So after having cracked the UG entrance with a single digit rank, I got into GMC Trivandrum, Kerala. And I did my MBBS from GMC Trivandrum. And the fascination for medicine, it came by, having a few doctors around. Some of them were acquaintances, some of them were relatives, and probably that is what gave me that spark and got me into the medical field. So from there, the journey started. And the journey of MBBS in GMC Trivandrum was something I feel, a great journey that I had. And fortunate to have been trained by some great teachers also in GMC Trivandrum during my MBBS days.
So you got a single digit in NEET UG, right?
Yeah.
So why not Delhi or Mumbai colleges? Why Kerala?
So actually, this was one doubt I always had. And there was a point where I had a confusion between taking JIPMER for MBBS versus GMC Trivandrum. And I had a talk with my parents also. Initially, I was slightly inclined towards JIPMER. But then again, as a person, I was more comfortable with, the home ecosystem, that is what I would say. And since basically I am from Trivandrum, and GMC Trivandrum is just 2 kilometers from my house, I finally decided on to GMC Trivandrum.
And what about Delhi colleges?
Delhi colleges, as I said, for me as a person, the ecosystem was very important, something I was comfortable with. So I thought, it's a long journey to start, the MBBS journey. So I thought, I'll start with from my hometown.
So does home ecosystem give you an advantage while you're studying?
Well, I think it's about a perspective. I know many of my colleagues who wanted to go to Delhi. They have done their MBBS in Delhi colleges as well. But for me, I think this was more comfortable and more of a personal choice. That's what I would say.
Did you ever regret it?
No, absolutely not. And I'm so comfortable.
Well, moving to medicine, you also got a great rank in NEET. I won't say NEET PG, I will say All India PG at that time.
Yeah.
You got a great rank. Medicine is always a very special choice, but it's a hectic branch. You must be getting radiology, dermat, or anything.
Yeah.
Why medicine then?
Well, see, when you look at my MBBS journey, I'll tell you to be honest, till my final year MBBS, I was not quite sure on what specialization I would take. To be honest, I was asking myself many questions. Uh, Maybe I had a slight inclination towards pathology till final year, and probably I was considering that as well. But I think in final year, I was again fortunate to be trained by some good teachers in the general medicine segment. And also, since I was from a government college, the sort of case variety that we had, I think, that actually ignited my interest in medicine. Diverse cases, the diagnostic challenges, just like solving a jigsaw puzzle. I think that was very much fascinating for me. And guided by some good mentors, that probably tilted me towards medicine. And by the end of final year, I was sure on one thing. When I give the exam, how many attempts I take, it doesn't matter. I am only going to take medicine. So I just had one choice in mind, and that was medicine.
So when the result came up, many a times even the most sure minds, when they get a good rank, they are confused between medicine and radiology.
Right.
Because everybody starts telling them, "Ki take radiology, it's the most financially benefiting branch." And that's a point of confusion, a point of apprehension that comes into every mind. Did it come into yours?
To be honest, no, in my case, because as I said, I was almost determined that by the end of final year, no, medicine is for me, and I'm here for medicine. So, general medicine was my passion, and yeah, that's it. Absolutely no confusion, to be honest.
So what was the first year of residency like?
So, see, I did my MD general medicine from GMC Calicut, Kerala. And if I may, I'll just tell you a story why I took GMC Calicut. So my MBBS, as I told you, was from GMC Trivandrum. And so during first year, there was a physiology gold medal exam for which I had secured the gold medal. And the first prize that I got ever for my MBBS was this book, A Doctor's Pocket Companion was the name of the book. And it was written by the head of the Department of Medicine of GMC Calicut at that time, Professor P.K. Shashidharan sir. So I liked the book, and it was my first gift as well as a medical student. So when I got a good rank for NEET PG, I was thinking, well, I'll take GMC Trivandrum, but then I thought, I've done my MBBS there. Why not give myself a different sort of exposure? And that is when I started thinking about Calicut, because the case variety there again in Calicut, especially for general medicine as a branch, has been much talked about. And again, some great teachers as well. So to give me a slightly different kind of exposure, I took GMC Calicut. And first year of residency, well, I think it's all about getting used to the system. You know that it is a transformative journey from a medical student to say, the junior most member of a health team, and if you can call it like that. So the initial part was about adjustment, and I think once I got used to the system, it was comfortable.
I have a complaint. 90% of you have still not subscribed to the channel. So before moving forward, please go ahead, press the subscribe button and click the bell icon. Did you face any kind of toxicity there?
No, absolutely no toxicity. And Dr. Nachiket, if you know, Calicut is one beautiful place. If you have been there, I think some very good people, and probably one place that I love to be, good people. That's probably why I married also from Calicut. And so great people, wonderful ecosystem, nice to be there. And I think that was the best choice of my life, taking MD medicine in GMC Calicut and to be trained by some good teachers. No toxicity, but again, the work was slightly on the hectic side, and that is understandable because of the number of cases that you would have. But as I said, I always had the passion for the subject, and for me, it was okay.
So when you were planning to go for DM, I think there comes a point in everybody's life when they think, ki, no, yaar, I have devoted enough time to studying, and now another 3 years for DM. I think it's going to take a lot in my life. Did that point come in your life?
So in my case, I'll tell you, taking medicine was just for general medicine. I never had super specialization in my mind. And, when I was doing residency, it is during second year that we had the rotation postings in the super specialty departments. And I had a 2-month posting in neurology, which was a relatively longer stint compared to nephro, gastro, cardio. So we had some good faculties there as well. Even I liked gastro, nephro, everything, I liked. But again, I liked medicine. And for the specific question that you asked, was DM in my mind? I wrote the NEET super specialty exam that just happened 1 month after my MD finals. Again, I just gave the exam. Even at that point of time, I'll be very honest, super specialty was not there in my mind. But there was some exam, I gave the exam. And I got a good rank. And then, I was a bit confused. Should I go for super specialization or, remain as a physician? Uh, Actually, after giving the exam, my initial thought was, I'm comfortable with MD medicine. It's good. But then, I talked to many of my teachers, and most of them were successful as practicing physicians. So I thought, why not stay like them? But that is when they themselves advised me, Rahul, the problem now is our country is moving towards a super specialization driven approach. So for a headache, people want to see neurologist. For a chest pain, cardiologist. And even for, some dyspeptic symptoms, they want to see a gastroenterologist. So he told me that in the long run, it would always be good if you are an expert in a particular branch. So he told that, otherwise there is a chance that in the long run you may repent. So I thought, fine, I got opinion from multiple teachers. They were all suggesting me to go for super specialization. And then came a dilemma. What super specialization? Because at that time, once you get the rank, you can choose. Now I got confused. And I'll tell you very honestly, the last day of giving allotment, I am sitting in front of the computer with my wife, Dr. Anjana, me confused on what to choose. Still remember, 5 p.m. is the closing time. At 3 p.m., we are juggling between options. I'm just telling her, shall I put cardio first? Or shall I put gastro first? We were juggling between options. Actually, the confusion was not because, that I wanted to find which was best for me. The confusion was because I liked general medicine over and above any super specialization. Because that is why I took medicine, not because I was attracted to neuro or cardio primarily. So at that point of time, I was thinking about multiple options at that point. And 5 p.m. is the locking. I think it's almost at 4:45 p.m. I told her, I think, a branch that is more close to actual clinical medicine looks like neurology, taking the history, examining the patient. And that is when, just 15 minutes before the final locking, I decided on neurology. This is a very honest story. Everything that I said is absolutely true. And, I just went ahead with neurology. But I had a liking for neurology, but yes, I was just confused on what to actually select.
That's very inspiring. Such a tough decision, and I like the process that you used to, finalize that decision. So, how was your neuro first year as a resident?
Okay, right. So I did my DM neurology from GMC Trivandrum, Kerala, and a very nice department. 3 units were there, and every year they have an intake of 5 neuro residents. Now, as I said, whether it be for MD medicine or for DM neurology, the first year is mostly about getting used to the system. And that is where many people face challenges as well. So the first 6 months, is about getting accustomed to the system. When you are a final year medicine postgraduate, you are the king of the ward. You decide terms, you decide how the patient should be evaluated. You have juniors, you have got interns. But when you become a first year neurology resident, There is no intern. You are the junior most person in the team. So every investigation you only have to write. So it was a different kind of experience, but I really enjoyed it because I've seen, many people complaining about doing some sort of clerical work, entering investigations. But I'll tell you, to be very honest, I think that is also part of the system because, when you write a discharge summary, I always believe, writing a good discharge summary is actually a signature of your efficacy as well. Because if you can summarize the entire clinical presentation into a couple of pages, giving an exact idea what happened to the patient, I think that is always good. And I really enjoyed first year. So, as I said, the beginning part of first year was about getting used to the system. And then something unique about neurology training is you have to develop an approach. For example, when you're doing MD medicine or DNB medicine, you're again dealing with the same sort of cases, stroke patients, Guillain-Barré syndrome, multiple sclerosis. But again, I think when it comes to super specialization, the most important part is to develop an approach. Like, how will you approach a case of headache? How will you approach a case of paraplegia, hemiplegia, a proper systematic approach? So I think the first year was about developing this approach as well. And as I told you, in GMC Trivandrum, we had good case load as well, which helped me in the first year of residency to develop an approach and getting used to the system. So that is what happened in first year.
It looks very exciting.
Right.
Normally, sir, people are medicine residents, they are confused whether to go directly for DM or do SRship first.
Right.
What's your opinion?
So I think personally I would prefer them to take super specialization as soon as possible. Because when it comes to NEET PG entrance preparation, if you look at the crowd of people who are getting selected, most of them are repeaters. I mean, there are people who have gotten first chance, but a good chunk are repeaters. But when it comes to super specialty exam, your first chance is always your best chance. And why I say this is because anyway, for MD or DNB finals, you have to learn all content, right? So once you are done with the entire Harrison reading, if you can just align yourself to the MCQ mode as well, you can crack it in first attempt itself. I cracked it in the first attempt. The exam happened 1 month after the my MD finals. So otherwise, if you just think about your final exams alone and then to take the exam 1 year later, you would have to again read the entire content again. And in the academic journey of a medicine resident, your peak knowledge is usually towards the end of your final year. So a bit of fine tuning in the MCQ mode, I think you should crack it in the first attempt. You should at least try to crack it in the first attempt is what I believe.
You have also utilized the best as home advantage. You have done all your degrees from Kerala itself.
Right.
Can you tell us in detail? Because the reason I'm asking this question is right now NEET PG counseling is going on,
Right.
and many people are they are from Kerala, they are getting options in UP. UPites are getting options in Kerala. So the point is that they're getting, let's suppose, an A college in Kerala or A minus college in UP. And this is the major confusion is that they should travel to Kerala, they should take that A minus college and stay in UP. So can you tell us in detail about the home advantage?
Right. So basically, when you want to select a college, I think you have to consider multiple parameters and not just a single factor. So number one is you have to have a genuine liking for that particular branch. And that is most important. Number two, you have got to select the college. Now, selecting the college, I would say that is something to be taken very seriously, especially for the mid-rankers, wherein they are not getting probably a top choice, because for top rankers, I think the decision is relatively lot easier. But otherwise, you have got to understand that I don't think it is the home advantage that has to be given first priority. It is basically the system itself. And that is what I talk about, the system. You try to understand how is the system. Suppose if you want to do your MD medicine from, say, Delhi, and you want to select a particular college. You try to understand, okay, how many consultants are there, how many postgraduates, what is the work schedule, how is the work environment, how is the work life balance. And for understanding all this, it is always better that you talk to someone who is doing second year or third year or maybe a senior resident. I would always tell everyone not to take advice from a first year resident. Why? Because he's probably the most overworked person in that department. And imagine if you call him over phone and what is your comment about the academics in your department? He's doing a lot of running around job, and you may not get the exact idea. So what I feel is you have got to take the right opinion. And home advantage is just one aspect of this. Now, that is a personal choice that I said. It is not something that has to be given a priority or something. But again, if that is also there, it is of advantage, especially for branches like medicine, where you can communicate with the patients in, your own language. That is always an advantage. And but even otherwise, suppose, you're taking some central institutes, say you're taking neuro in NIMHANS, so the 6-year course, it's a central institute, so they understand that, there is a bit of language barrier for many people, and they do give that, cool period initially to understand the language as well. So I think it is, for the question that you asked, they have got to take multiple factors into consideration.
True.
Yeah.
I believe the language part is the best advantage when you take your college in your home area. Because you were in Kerala, you understand Malayalam, automatically conversing with the patient, understanding their problems becomes a lot easier.
Right.
And I also believe that even the professors are more and more conversing in Malayalam itself. They are not using neutral languages.
Yeah, they do with the patients, they talk in the native language. But again, suppose if there is a resident, like from another state, they're always very considerative and, considerate, and they do take that also into consideration. Yeah.
But many people, especially Gujarat, I have heard that professors deliberately are speaking in Gujarati itself, and the outsiders are not able to understand anything.
Right.
And similar cheese, if you do in, for example, Delhi, maybe UP, you will automatically be conversing in Hindi itself with the professors. But even when you start talking to the patients, they are conversing in the local dialects.
Correct.
So you give 3 to 4 years of life understanding the local dialect, and then you have to go back to an area where that dialect doesn't hold any kind of meaning.
Correct. But again, I think if you can learn the language quickly, as many people do, I think after the initial 6 months, I think the initial 6 months getting used to the system, if at all there is some sort of a language barrier. And that is what I talked earlier about, getting used to the system. And I think many people do catch up. And, we are seeing that many people from south go to north come to south, like that.
It's a difficult transition, I would say.
Yeah.
So what was your normal cases during your DM days? Yes.
So basically, as I told you, I was doing my DM in GMC Trivandrum. So, we used to have a wide range of cases. And from emergencies like stroke to chronic diseases like Parkinson's, Alzheimer's, to migraine. So all sorts of cases we had exposure to. And that is very important. Many people compare the sort of training that you get in Tier 2 versus Tier 1, maybe central institutes. But one advantage, that central institutes candidates may not have is some of the common illnesses may not come to central institutes just because most cases are referral cases. You take a case of NIMHANS. Now, how many cases of migraine would actually come to an institute like NIMHANS? It would be less. It would be there, but again, would be relatively less. So during my training, I had the fortune of getting exposure to, almost every textbook case, that you can refer to.
So what was your typical day for being a DM first year resident?
Right. So as I told you, there is a transition phase when you go from first year residency, second year, third year. First year was mostly about ward work. You have to be in the ward, and what sort of learning should you go for is a patient-centric learning. It's not that, you start your day reading some textbooks. It's like you see a case, maybe it can be say a Guillain-Barré syndrome, and you have an approach to diagnosis, you localize, you diagnose, you do the electrophysiological testing, you diagnose, you treat, and then you read more about it. are there any, new updates regarding the treatment? You try to understand more about it. So first year was that. And I think second year is when, my thought process actually changed. And I'll just tell you one story. So after I was done with my first year of residency, I thought that I had done my first year well. And in second year, that is when we are allowed to go to conferences. So our HOD was of the viewpoint that you should attend multiple conferences because neurology is a clinical branch. So the more you are exposed to different faculties, your approach gets refined. So I went to one conference, and probably the first conference that I attended in second year is, it was actually an eye-opener for me. Why? Because I got to meet many people from different colleges across the country, understand their perspective. Then I thought, I think I should put some more effort. There is a lot more to neurology. Hearing some of the eminent speakers, I thought, I think I should be a bit more aggressive. So second year, I attended multiple conferences, and this is what I would tell all the aspiring neurologists as well. When you are into residency, being a core clinical branch, it is very important to attend conferences, because if you are just if your academics is confined to your department alone, you would rather have a sort of tunnel vision. But attending multiple conferences helped me refine my vision about neurology. I have not done DM in Central Institute, but attending multiple conferences gave me the opportunity to attend to lectures of top faculties of every Central Institute, be it Sri Chitra, Nimhans, JIPMER, AIMS. I have listened to super specialists across all these colleges. And that actually helped me refine my approach as well, because, it's like you're studying in one college, but your academics is not having a boundary there. You're learning from multiple people. So attending conferences actually, helped me a lot in that. And second year, as I told you, since I felt a bit more in sync with neurology, it was a good year for me, second year of residency. And third year of neurology residency, again, the later part of second year, it's mostly about thesis work, managing your stroke duties. You've got stroke duties as well. And then into final year DM, again, you are given more responsibilities. Again, related to management of stroke, you've got to take the calls, and you're directly involved in the decision making as well. And that is what happened in third year. And third year, you'll have to prepare for your DM final exams as well. So that also had to go in side by side. But again, this is a transformative journey that I had from first year, second year, and then till third year. Yeah.
So post your DM, what was your first step?
Well, interesting question, because I had an area of confusion here. Because after DM, I wanted to start practicing. But at the same time, I had options of fellowships as well. Now, this is where I had to, ask myself certain questions. What do I actually want? Should I go for, again, a fellowship in stroke or movement disorders or neuromuscular disorders? But then I thought maybe, I would like practicing as a general neurologist. So that is when I took the decision, no, enough is enough. I'm not going for any fellowships. I'm done. I'll just settle as a neurologist, and along with that, a bit of teaching as well.
I'm just surprised that you call it general neurologist. Yeah. That the world has come to this point that even after neurology, you have to call somebody a general neurologist.
Yeah.
So what are the normal fellowships that are available after neurology?
So after neurology, you've got fellowships in epilepsy. You've got fellowships in movement disorders, fellowship in stroke, fellowship in neuromuscular disorders. So these are the major fellowships that you've got after neurology, and also in cognitive neurology as well, you've got fellowships. And again, places do offer fellowships for demyelinating disorders as well.
So I think even 10 years back, you got this answer that DM is compulsory after MD. 10 years back, or I don't know. When did you pass your MD?
So basically, in my case,
Yeah.
as I told you, I took MD medicine just with the thought of taking medicine. And only towards the fag end, towards the counseling time, I made up my mind that I'm going for super specialization. But one point I would like to address here is many a times, MD or DNB medicine is wrongly perceived as a bridge towards specialization. I think that is a wrong concept. You have to be a good specialist first to be a good super specialist. And that is what I believe. Because a strong foundation in internal medicine is important. Because even if you want to take neurology, you would come across maybe a patient with SLE, with secondary APLA syndrome presenting with stroke. So you have to know the basics of management of SLE, APLA syndrome. You will come across embolic strokes. So even between super specializations, there will be integrated cases, and that is why a strong training in general medicine is important before you go to your super specialization.
So can I just say that the way your seniors advised you that DM right now is compulsory, can you say the same thing for fellowships, that even like 10 years down the line, fellowships will be compulsory after DM?
So regarding the first point, I would not say that DM is compulsory after MD medicine, but at the same time, uh, the way it is going in our country, it is more of a super specialist driven culture,
Yes.
which I totally don't agree to. I think we'll have to refine our health system.
But that is the bitter truth.
Yeah,
We can't run away from
we
that.
cannot run away, but that is how it runs in our country right now. Regarding fellowships, again, it is like where you want to get down from the bus. You can get down early. The stop that you feel comfortable. Yes, I'm going to get down here. You get down, and that is very important. You can climb up the pyramid. You can even go beyond that. But again, it is your happiness what actually matters.
But isn't that the paradox that everybody is struggling with? The paradox is not of today. You see, even if you are an MBBS, you can always earn money. MD, you can earn money. Money is not an issue here. But the respect in the society. Because if you are a group of doctors who are working together since MBBS, everybody does MD, it's a compulsion now. All right. For medicine and surgery, especially now, everybody is doing DM and MCH.
Right.
Even if they are not doing it right now, you can always feel that they have a slight bit of regret that we are not going ahead with it because they had taken that stop. But 10 years down the line, when everybody sits together, I always believe that the respect for people doing DM and MCH is slight more than people who have not done it.
That
And
I
you can always feel it inside.
That is absolutely right. Because, see, suppose you are my junior, and I have done my MD before you, but you have done your DM. Like you have done your DM in neurology, and I have not done. Now we go to a conference, and maybe there is a talk going on with regards to, say, Guillain-Barré syndrome, and the session is open for an open debate. Now, your point will always have a value over mine if you are a super specialist. Because the world is advancing like that. There is a lot of advancements happening place. And if you want to, be in at pace with all the advancements in all the super specializations, it is difficult. So that is why I feel, it will be nice if you can take one super specialization, and then, you can excel in that.
So post your DM, you thought of doing practice now.
Right.
So you immediately jumped to the practice, or did you do any kind of job also?
Right. So basically, after my DM, we had 1 year of SR-ship. Okay. So I did my SR-ship, and then I started practicing, and I'm currently practicing now in a mission hospital, that is Ramakrishna Mission Hospital. Because again, for me, having done my MBBS, MD, and DM from government colleges, I think I was more comfortable with such sort of a system over a corporate setup. And that is why I chose a mission hospital, which works more or less like a government hospital. And the patients that you see are mostly lower middle class to middle class patients. And that was my comfortable ecosystem. And that is why, I joined a mission hospital for practice.
So what else did you not like in a corporate hospital?
So it is not like, I did not like, it's that I was more comfortable with this. And I feel that is very important. After you're done with, say, DM neurology or cardiology, there are n number of options available. I think you've got that liberty to decide the way you want to work. And it is about choosing wisely. It is not like one shirt fits all. And we'll have to take that also into consideration. So in my case, this was my comfortable ecosystem. That is it.
So what were your early days in practice like?
Right. So in my case, working in a mission hospital, it was challenging because, again, you are independently making decisions. All throughout your training period, it was all about being a part of a team. And here you are making decisions of your own. But again, thanks to all my teachers who have trained me, I thought, yes, I can do it. And even for cases that I come across in my mission hospital, I think, we try to manage the patients according to the standard protocol itself. And yeah, that's it, comfortable working there.
And normally how many patients you used to see initially?
So, see, in my case, I was very fortunate. I'll tell you why. Because, once you start your practice, getting a good patient load initially might be tough. But in my case, since I was doing my practice in a mission hospital, the first day in my practice, I just came to my OP first day. I actually had a good patient load right from day one. And that's because, it was a mission hospital, a government type of hospital. So in my case, the journey was a lot easier. I did not have to struggle to build up practice. But in every case, it may not be like that. So that is what I said. Challenges are different for everyone. Someone listening to this podcast cannot generalize the life of a neurologist through me. The challenges I faced, or maybe some sort of struggle, if at all I had, will be different from something that another person had. But in my case, I think the journey initially in my practice was a lot easier.
So you never thought of starting your own private practice?
I do have home consultations, but again, it is actually easy to be a part of a system because, again, for neurology, you need support like EEG, nerve conduction study, sleep lab. So I think being in a system is more comfortable. And I think that was more of, again, my ecosystem, as I would say. Private practice, again, look, if I went into private practice alone, then that would mean that I would have relatively, say, less exposure to other disciplines. But again, when you are in neurology segment, you always want to have, maybe a patient with stroke, you would want to do an echo. So private practice has to be there just as a support. Again, in my case, it is there. But again, I was more comfortable with being in a system.
Did it ever come in your mind that while you were doing neurology, that you could have chosen any other super specialty as well?
So in my case, even now, my love is not confined to neurology. And that is why in my hospital, I see not only neurology patients, I see other patients as well. Even patients with acute coronary syndrome, I see those patients. So though I am a neurologist, my love even now is for medicine.
So if you have to differentiate between neurology and how it is different from other branches like cardio, gastro, nephro, what do you think will be, the USPs of every branch and why you chose neurology as your favorite branch?
Right. So see, neurology, cardiology, gastroenterology, everything has its own charm. And what I saw in neurology was, I felt that neurology was more closely the actual medicine, is what I believe. Okay, you can have difference of opinion as well, but I felt that it was more about the the conventional history taking, examination, and even, in our MBBS days also it's like that, right? When you take a long case, it's usually a case of a stroke
True.
that comes for your exam. So I felt it is more closely with the actual clinical medicine, and I always liked it. Lesion localization, then possibly trying to understand what is the etiology. So that was more closely with the actual clinical medicine part. This is one reason why I liked neurology. Again, but all of the branches, I would say, cardio, gastro, all are wonderful branches, and I can see my colleagues in all these branches who have taken it out of their passion, being successful in all of these.
So if you have to list down, the best being on the number one and the last being number 10, how would you rate all the medical super specialties?
I think I'm no one to rate, all these super specializations. I would say that everything is number one. It's just about how you perceive it. For me, I like neurology, but again, for another person, the interest might be in cardio. But I would say that, look, whatever you take, you do it with passion. Because Dr. Nachiket, I'm a neurologist. I'm a neurologist today, tomorrow, until I die, right? So I have to have that passion. So once we are done with this podcast, I'm going back to Trivandrum. Tomorrow I have my OP. I should be excited for tomorrow. I should be excited for the next day as well. And I should be excited for all the coming years as well. So if you are able to maintain that excitement for that branch, I think, that is what keeps you going.
So where do you see this branch 10 years down the line?
See, I feel I'm really excited to look, for the advantages, the advances that are likely to come in the coming few years, especially with AI. And I can see that in the coming years, neurology is going to boom, just like other branches. Especially what I would be fascinated to see, rather than making predictions, I would be fascinated to see how, say, neurodegenerative diseases, for example. I take classes for NEET Super-Specialty, INI Super-Specialty. So candidates conversing with me who are thinking about neurology, and if there is one point that is driving them away from neurology, and 90% of cases, students ask me, "Sir, don't you think there are a lot of diseases which cannot be treated?" And these diseases the students are referring to is not about stroke or demyelination. They're referring to neurodegenerative diseases like Alzheimer's disease, Parkinson's disease. But the future looks bright, just like we have got new monoclonal antibodies for Alzheimer's disease. So in the coming years, if we see good benefit with these monoclonal antibodies, maybe targeting A beta amyloid and probably reversing neurodegeneration, and maybe for Parkinson's disease. A disease like Parkinson's has a mean age of onset at 60 years. But it is said that the neurodegeneration starts at 40 years, where the symptoms of the patients will be very non-specific, like some constipation, anosmia, but we are not able to diagnose. Why is Parkinson's disease not a treatable disease even now? The simple reason being the neurodegeneration. You're diagnosing today a patient with Parkinson at 60 years. The neurodegeneration has happened 20 years back. Now you are not in a position to reverse it. But if at all we get some markers for early detection of Parkinson's disease, that can very well make advances in the treatment of such neurodegenerative disease. So one thing that is exciting me is the advances that are likely to occur in the field of neurodegenerative diseases. Number two, I'll be excited to see the advancements in stroke treatment. Now, even now, the last few years, take the last 10 years, last decade, has shown significant advances in revascularization strategies for stroke, like thrombolysis, thrombectomy. In 2018, we have had landmark trials. So that means the stroke advancements are happening and it is real. And in the future also, I would like to see what more advancements are happening in stroke neurology as well. That is one thing I want, I'm also fascinated about. Then maybe is the impact of AI is something I am also excited about. So regarding AI and neurology, I feel EEG interpretation is something that will be refined. EEG interpretation is going to be more sharp with the AI coming up, and very important, neuroradiology. You know, as is always said, for every radiology report, there is a last line, please correlate clinically. But I feel, yes, even now, they'll have to write, please correlate clinically. But again, neuroradiology is going to have a significant advance with AI. And it is not going to replace radiologists, but again, it is like going to refine, their skill. It's an added skill that they would have, the support of AI. And that is one area that is going to impact neurology as well, because decision making in neurology many a times is dependent on the neuroradiological interpretation as well. So, and lastly, I am also fascinated to observe the advancements that will occur with the robotics. So especially for stroke rehabilitation, stroke rehabilitation, robotics assisted. So that is also one area of advancement that I am fascinated about. Right.
Future looks really bright, boss.
Yeah. For neurology, I feel it is the future is bright, and like though I cannot make predictions, I am excited as a student of neurology.
So I'll ask you one of the most asked questions of our podcast. How much does a neurologist earn immediately after doing DM, 10 years down the line, 20 years down the line?
So for a neurologist to begin with, down south, the payment is better compared to, say, Delhi. Like once you're done with DM neurology, you're joining, say, the private sector. I'll talk about private sector first. I think you will definitely start with above 3 lakhs for sure. I'm down south. But, if you look at Delhi, some of my colleagues, my students, they are practicing in Delhi as well. There, the initial salary is somewhere in the range of 2.5 to 2.75. Okay, some places even 2.25 as well. So that is how you start with. And again, it also depends whether you are attached to one hospital, multiple hospital, do you have your private practice, and your area of expertise. These are other variables that can definitely contribute to this. What I am saying is just a rough figure for someone who will start off with. But again, in the coming few years, depending on your area of expertise and what value you add to the hospital, maybe you are, you're having a fellowship in stroke, so you have got a stroke unit, you're heading that, then automatically, the revenue will increase based on that as well. But when it comes to the government sector, the pay is relatively less. And say for an assistant professor, say down south, the pay is to begin with around 1.2 to 1.3. Okay. So there are other colleges wherein the pay starts at 1.5, but that is where the pay starts at. Now, this is one reason why you will see that there is a reluctance among young neurologists to go into government service. And this has happened recently as well, where I've seen that, some of the rankers have not opted for government service because the pay is relatively less. But again, what I believe is it is passion that should drive you forward over money. And if you chase money, you will never be able to find it. But if you are doing your work reasonably good, even if not the best, reasonably good, money will come to you. But for all the young neurologists, if you want to take this branch, money should not be the primary driving force. You try to excel in your capabilities, in your area of expertise. That is what I want to tell them.
So what is a life like in a corporate hospital for a neurologist?
So in a corporate hospital, the work-life balance is good for at least many of them, not all. So again, choosing a corporate hospital, if at all you want to work, again, you will have to choose it wisely. And but in general, if I say that for a neurologist, since stroke also comes under the purview of neurology, you're likely to get night calls. And you are likely to have the first call if you are say a junior neurologist. So obviously, in the beginning few years in a corporate hospital, the work will be slightly on the hectic side, and most of the emergencies you will have to handle. So at times you might feel that you are almost reliving your residency days. So in the initial 3 years, maybe. But again, once you build practice, once you become a bit more senior, then I think relatively the work-life balance becomes a lot easier. But as you rightly said, the initial years will be a bit tough in the corporate segment.
I think, sir, after listening to you, one thing is sure that the settlement period for a neurologist is very long. That at the age of 35, I think a neurologist actually starts his or her journey. Isn't that too long?
Well, again, see, as I said, I have my colleagues, uh, five, we are actually a batch of five residents. So if you look at five of us, just take the example of five of us. One of them, is working in a corporate. I am working in a mission hospital, and another one is with the Indian Navy. The another person is working in CMC Vellore. So another person has gone for general medicine itself, as a faculty in government service. So what I think is it's the way you want your life to be. The settlement period, financially stable settlement period. Yes, the journey is on the, it'll actually take some time. But again, if you are passionate about this, I don't think you will feel the journey to be long enough. Okay, because even now, when people remind me that, okay, I joined the hospital this many years back, that is when I also think, oh, it has been these many years. Very honestly, I get that thought as well, because for me, every day is exciting. And that passion is very important. Otherwise, see, just imagine, over the last several years, what I've been seeing is commonly 10 diseases in neurology: headache, come across migraine, then maybe myasthenia gravis patients, patients with radiculopathy symptoms, Parkinson's disease, Alzheimer's. So you take 10 diseases will be common. And most of the days, 80% of my patients will be related to these 10 diseases. But if I don't have that passion, I will not have that, fire in me to go or go ahead with my practice. So I think being passionate is very important.
Suppose if I compare now DM and DRNB, I think both are super specialist degrees now. But do you think there's a difference or bias around DR, DNB in the market?
So I don't think it affects to a big scale, because when it comes to say job opportunities, in my experience, I have not seen a significant difference. Yes, always DM has a slight advantage over DNB, but again, if in the say if you're working in a corporate hospital, uh, getting a job opportunity is not majorly dependent on it. If you are reasonably good in what you're doing, and if you have also got options for doing fellowships as well. But even if you don't do fellowships, I think once you start your practice, I don't think, if at all, there is a marginal difference that actually fades away in the long run. That's what I believe.
Yeah, but as you know, the NEET PG counseling is going to start soon. So many students want to know that how they should judge a college. So what parameters should they utilize to judge a college for general medicine?
Right. So it's a very good question, because many students, after their NEET PG ranks, they take a college based on hearsays, what they probably see in social media as top 10 colleges for general medicine. But I believe the system in a medical college for every department keeps on changing. For example, I told you that I had done MD General Medicine from a particular college. So I went to that particular college seeing certain faculties and the system in place. Similarly, every candidate should select a college seeing the system. You have to know the system. And if you want to know the system, as I told you earlier, it is better that you do a proper research. You have to find out contacts, preferably a second year or a third year resident of that particular college. Just give them a call when they are free, or even a senior resident, or even an assistant professor, and just ask them basic questions like, just to know how is the overall functioning of the department. Number one, how many units, how many faculties, how many residents per unit. And one question that I always tell students is ask someone how a week is like for a resident of that particular department. You know, how does the day start? What are your work hours? Are there academics? And are the academics streamlined? What about ward rounds and thesis work? And do they get off? So you have to ask all these questions, and also the laboratory support. Suppose you are doing, say you're taking medicine in a college, but the ICU support is not good. Don't you think that that is going to affect your training? Because if the ICU support is not good, the management of critically ill patients will not be good in that particular college, and all what you will do is that you will refer to some other college, and that would definitely affect your training. Because as I said, building a strong foundation in general medicine is important before you go for a super specialization. So that is also very important. And also the laboratory support, that also I've seen. Maybe with regards to blood investigations, many of them, maybe even high sensitivity troponin assay not being available in a particular college, that will definitely affect the quality of management of conditions like acute coronary syndrome. And also having a radiology support. Suppose you are working in the medicine department and there is no CT scan available, then how are you going to manage a patient with stroke? CT is not available, MRI is not available. You are just going to be a referral person. So it is important to understand the system and not be biased with list of colleges, because those lists may have been made by someone say 5 years back. And maybe in a particular college, those maybe some college which is ranked high, all the professors would have retired, and probably that college is not the same, or the department is not same as it was before. So it keeps on changing, and I think that the NEET PG counseling, the students should make a proper informed judgment before they actually choose a branch, and try to understand what system are they going to. And I tell this because I have seen students struggling after making a wrong choice in terms of branch, without actually understanding the branch per se. You should not be choosing a branch just because you like reading about it. Suppose I like psychiatry, I like to read psychiatry, but I may not like to practice psychiatry. And sometimes some students might take a college without understanding what is the work culture of that college, and then comes the problem of toxicity. I think the issue of toxicity, is something that we all should talk about.
True, sir.
And I believe that in lot of colleges, this problem is there. And I have seen many of my students, not just medicine postgraduate, but also neurology residents, coming back to me, calling me over phone and saying that, sir, I'm going through a stressful phase. Because I often connect to my students, they're always free to call me as well. And this actually happens in multiple colleges. As a teacher, this is not something that I like to see. Because, I think just like you would like to have a good environment around you, you are also someone else's environment. So if somebody wants to work well in a system, I think the work culture should also be good. And sometimes, issues of toxicity, hierarchy, that puts a lot of toll on the mental health of residents. And I am a person who strongly vouches for mental health, because I believe, residents should be given duty offs after, say, a 24-hour duty, because we are not computers. Because they have to make important judgments that can be life-saving. So proper rest for them is also important, and giving them a good work environment is also very important. So as they say, live and let live. And it's important, like when you go up in the hierarchy, it is important that you do not look down upon your juniors. See them as your colleagues. Give them a good environment. Inspire them, teach them, and that is what you should be doing. You should not be making life miserable for them. Even if you don't help them, that is okay. but let us not make life miserable for our juniors. I think everyone should actually make sure that junior residents, maybe uh, whether it be first year, second year, third year,
So, but why
you
does
know,
this happen actually? I don't understand why do people enjoy torture? Why do people enjoy torturing JR1s? Because I've seen so many people, I've seen so many senior doctors, okay? I have heard from other people also that, it is to make them, basically tame them. They use words like this that we need to show them who they are, that they are the junior most in our department, and for that purpose they have to face the torture. Because in our time we used to feel the same, so they have to go through the same difficulty, struggle, and they tend to make it more torturous. Why do people have this thing?
well, I think it's about your mindset, and it may not be that they intentionally want to make life difficult for another person, but eventually some of them turn out to make life difficult. So I think every year, I think when a new batch of residents join, it is very important that the entire team of consultants, assistant professors, including them, then the residents, actually talk, guide them, and try to understand the how to function in a department, give them guidance. That is what I think should be done, because I am more concerned about the preventive aspect of this rather than the treatment of what you actually said. I believe we should all make effort. Now, there are incidences happening in multiple colleges, but what we can do, at least as the younger generation, is we can make the environment better for our juniors, and if we make it for them, they might also make it better for their juniors, and that is what you can do. Probably as an individual, you cannot make radical changes, but one change that you can make is you can be good to your junior, and I'm sure that if you do that to him, for example, if I am working in a hospital, I make sure that my intern, I work in a mission hospital, we have got interns. So I make sure that, have you taken your lunch? Are you taking a duty after you're done with your food? It is very important. And that simple question is important because I am sure that he would do the same to his junior.
Very
And I
true.
think that is what, we all can do. But again, what you have just pointed out is a matter of debate on why this actually happens. But for me, I think the first change should happen from, ourselves. So that is what we best can do.
So, considering the fact that DM, we are talking about DM as a branch, uh, when a student has passed MD medicine and he has to choose which super specialty to go for, all right, what are the kind of characteristic you would say that if you have this thing, then you are best suited for this particular branch?
So regarding the choice of super specialization, again, it comes to uh, what exactly in general medicine excites you. Suppose it has always been the heart that has excited you, and that is the love at first sight. You like cardiology, you like heart right from day one of your MBBS days. Straight go to cardiology. But again, if you like a bit of, say, interventional procedures, then maybe you can think of gastro because you have got the scopies. Suppose if you like a bit of, say, uh, you know, aggressive mindset, but you don't want to spend much time taking all history. Nephrology is one branch because that choices are more spontaneous in nephrology when it comes to management. But again, if you have taken medicine, but you do not want your life to be too hectic, branches like endocrinology, rheumatology, which are less likely to have all these night calls like neurology or cardiology, then you can think of those branches as well.
So, what would be your advice to a new student joining as JR1 in medicine?
So, regarding my advice to a newly joined junior resident in medicine, first of all, understand the journey is going to be long, but it is going to be exciting. And have that childlike excitement within you. So, you start your journey, but please understand that you are a part of the system. So, try to understand what the system demands from you. Like, you may be a junior resident, but you can add a lot of value to the system. Try to understand like how the department functions, how you can add value to it, have good work ethics, be on time, be punctual, and be honest. A consultant never likes a resident who bluffs. Even if you have not done something, just accept, sir, I've forgotten this or I have not done this. It's my mistake. I apologize. This is always better than bluffing because you have to maintain your integrity. So, for all the JR ones, the first 6 months are crucial. And once you gel into the system properly, I think, you're likely to have a good period during the rest of your, residency journey.
Very true, sir. Sir, out of all the super specialty branches, which one do you think will get the most hit by artificial intelligence?
So, artificial intelligence, I believe, is going to augment most of the branches, and not just neurology, but the diagnostic precision and management in all super specialties will be enhanced. And I personally don't think it will take a hit because the branch will get more refined. The way the diagnostics are done, the way decisions are made, things might change, but I don't think there is going to be a major hit. But again, never know what is coming your way.
So you were a pretty established neurologist in your area. How did you get into teaching?
Actually, I started teaching long back. The thing is, during my MBBS days, we had these seminars, right? Wherein you would take small lectures for your friends. So I used to take it reasonably well. And I used to like teaching my friends as well, and mostly general medicine, because that was my subject of interest in final year, as I had told in the earlier part of the interview. So I thought, teaching also excites me. And then later I thought that after getting into MD medicine, I thought I'd like to teach a bigger crowd of students. And I thought, teaching students for NEET PG would be nice. So that is where I started teaching. Later, I started teaching FMG students also. So once I was done with my super specialization, I started taking classes for the super specialty entrance exams as well. So basically, being a teacher, the advantage it offers me is it keeps me on my toes. Since I am teaching a diverse crowd of students, I should know to teach the topic of, say, subarachnoid hemorrhage, both to a NEET PG aspirant and to a NEET SS aspirant in two different ways. And I should have that ability, but that is exciting for me. If I take a lecture for NEET PG aspirant, which is relatively easier, but when you take it for NEET SS, you have to stay updated. Couple of years back, the guidelines for subarachnoid hemorrhage, there were certain changes. But for me to understand the changes, I need to read the entire document. Because again, for super specialization, super specialty entrance, you have to be updated. And that is very exciting as well. So that is how my teaching journey was.
Sir, if you became an education minister and you have to change something about the NEET PG exam, the prospectus, the curriculum, what would you change?
See, regarding NEET PG entrance exam, if I was the health minister, there is one change that I would make. And that would be to announce the exam date properly at least a year before. Even as we are speaking, both of us do not know what is the date of NEET PG 2026.
True.
Okay. Now, this puts a lot of stress on the students. In fact, you've got almost 2.5 lakh students preparing for this exam, not knowing when is the exam going to happen. Now, this unpredictability is quite disheartening because these are students, some of them who are working, and for them to prepare, they'll have to take leave from work and then prepare. It is unfair that these students are not given the basic right of at least knowing when the exam is going to take place. So one change would be that.
I think that's the most important change. I think NEET PG is such a, what do you call, a ghost exam now. You don't know when it is going to appear. You don't know when it is going to happen. You walk through a door, you are going through tweets, and suddenly a tweet comes in ki exam is din hoga.
So, Dr. Nachiket, you were talking about NEET PG exam dates. I would also like to emphasize on the NEET SS exam dates as well. Even for them, the situation is not different because the NEET SS this time happened a few months back. In fact, there was a postponement, and NEET SS 2024 happened in 2025. And now students were talking, when is the next exam? The debate was whether it will be Feb 2026 or March, lot of debate happening. And suddenly an announcement comes, NEET SS November first week. Okay, all of a sudden. Now, these are people who are actually working, for them to prepare. Please give them some time. At least they've got that basic right to know when the exam is. And for both NEET PG and NEET SS, I'll make sure the exam date is announced 1 year ahead.
So it's a very important change that is required. Everybody should know what they're preparing for, when the exam is going to happen. And sudden changes kill the motivation, it kills the mood, and it is just, creates hatred amongst the students.
Right.
That's a completely wrecked up exam system. So you have seen the system from outside as a medico, from inside as an educator. Which branches, top 5 branches you think will, boom in the upcoming 10 years?
So one I would feel will be neurology. Yes, I'm a bit biased, but I'm seeing the world through my eyes. And then I think radiology, definitely radiology. And the precision of diagnosis in radiology is significantly going to boom. That is something that is sure about. And then even for pathological diagnosis, especially with regards to the genetics part, I think that is also going to be something that is exciting to be looked upon. Then psychiatry again, because the stigma related to psychiatric complaints is slowly coming off. At the same time, there are a lot of psychiatric issues as well to be addressed, and that definitely will be another branch to look out for. But my 5th choice is my wish. I don't know how much it will happen. I would like to have preventive and social medicine being given more importance. The reason is because, look, more and more advances are happening. New drugs are coming up for diabetes. X drug comes now, another 2 weeks later, Y drug. But what about the preventive aspects? What about educating the masses about the importance of diet, lifestyle? So preventive and social medicine is something that I wish is given more importance among medical students and also for public awareness as well. So I hope, it also gets some new wings, preventive and social medicine.
Thank you so much, Dr. Rahul. I think you have given us everything we need to know about neurology, medicine, and your deep thoughts regarding how this medical world needs to change. But our podcast has not come to an end. We still have some pretty fiery, rapid fire questions for you. So, sir, it's a very simple game, very simple 2 rules. You have to be super spontaneous and super truthful.
I'll
All
try
right,
to
sir?
be.
Yeah.
I'll try to be.
Would you rather have more time or more money?
More time, because I feel this is a busy world. I need more time with my family, my kids. My kids are growing up. I want to see their, how they evolve over the years. So more time for me any day.
What's your biggest FOMO right now?
FOMO is keeping at pace with all the advancements taking place, and to the point that I keep reading every day. Every day morning, at least half an hour, I spend time reading.
Which app you would never delete from your phone?
Doc tutorials app, because that is where I'm teaching right now.
What's the last thing you Googled?
Googled.
Yeah.
So that would be distance from Delhi airport to your house after I landed.
What's the most random thought you have had till today? Random thought.
So a couple of days back, I was reading about migraine. So I just thought, do ants have headache? And what will be the mechanism of headache in an ant with such tiny brains? That is what I thought.
This was a good one. One goal you are working on right now.
So right now, I'm working on improving the neurology department in my hospital. Maybe regards to stroke management, we are procuring a new machine as well for EEG. So yeah, we are trying to improve the setup that we have in our neurology department.
Thank you so much, sir, for today's discussion. It was very interesting. You gave us everything we, as students needed to know about neurology, medicine, and it was just amazing to have this discussion with you.
Thank you so much for this wonderful opportunity as well. Nice to meet you and interact with you.
Thank you so much, sir. And thank you so much, everyone, for watching today's show. I believe sir has clearly dissected the whole branch of neurology for you. Nothing you need to know about neurology was not discussed today. Everything was very clear, very precise, and again, very interesting. Thank you so much. And before you leave, do not forget to like, share, and subscribe, and mention the next guest who you want in the hot seat. Thank you so much, guys, and best of luck.